Bismillahirrahmanirrahim. Assalamu alaikum. My name is Mariam Siddiqui, and I will be conducting now moving cupping followed by dry cupping and then hijama wet cupping. So I gave 10 minutes to my client to get ready. I will be performing leg and foot cleans. She mentioned that her feet are very cold, so I'm not going to do her feet, but I'll do the legs. So let's start. First of all, I'm going to, well, I did wash my hands, but I just want to sanitize again. So if you guys can see, these are my alcohol wipes. This is my sharps container. I have 3 pair of gloves, and then I have B3s for the thighs and the legs, and then B4s for the lower. I'm gonna see, I think I would need B4 on the lower leg. And then this is my coconut oil. You guys can see this is my coconut oil, this is olive oil. And so these are my alcohol wipes. I'm going to be using 1 each before, and then after incisions 1 each to clean. So I'm using, although I keep them separate, this is the alcohol wipes I'm using. I took out extras, and then either we can use Q-tips or we can use these cotton. It's your choice. Both are fine, and they are both are good. So I'm going to keep them separate because I don't want to contaminate them. So let's start. First of all, I'm going to apply coconut oil, and I do have a backup coconut oil also, but I think this should be enough. So Bismillahirrahmanirrahim. Oh, and I didn't show you guys, this is the Swan Morton blade. So I did order, okay, so I have 2 extras here, and then I have extras. I'm just gonna bring it close. So is it showing? Abu, is it showing? Okay. So you guys can see this is number 15 carbon steel, and I have extras here. So let's start. I do have my chair now. After sanitizing my hand, I'm trying only to apply to clean surfaces because need to follow the public health guidelines. So let's start. I'm going to be applying little bit oil here to first do the moving cupping, and then I'm gonna do the dry cupping, and then the hijama wet cupping. So I want to ask my client, say Bismillahirrahmanirrahim, and make an intention. It's okay, you don't need to take the face. She doesn't want to be in the video, but you have to make an intention. She is in wudu, and I am also in wudu, that we will be reciting surah, all the 4 surah Kafirun, surah Nas, surah Falak, and Qul Huwallahu Ahad, and Ayatul Kursi, along with saying Bismillahirrahmanirrahim. So let's make an intention. Healing comes from Allah subhanahu wa ta'ala. So when we are doing the moving cupping, it is totally okay to use bare hands. So she did not want to remove the socks. It's cold, so I will just be doing here and then the upper legs part. So I think we will do 1 leg first here. It is always a good idea to cover rest of the space. I'm using 2 towels, this one, and then I have an extra sheet also. So so I have 2 trash. In the city of Minnesota, the city bylaws say the blood contaminated goes in a separate trash, and the non-blood contaminated goes in the regular trash, basically. So let's try. I'm going to be I did one suction, if you guys can see, one suction, and if it's too tight, I can always make it less. Is it bearable?
Yes.
Okay, hang on. I think I need to put more oil because this is not smooth enough. So which part of the leg it hurts the most?
Right leg.
Is it? I'm going to apply 1 cup here and then 1 lower below. Usually we apply 1 suction, but I feel like it gets really tight on her. So if you see, if I apply 1 cup, okay, so far it's good. So I think we can go ahead. And so what I would do is start with the vertical, then go horizontal, and then go circular. And what it does is it is good for the myofascial release, and it increases blood supply. I feel like there may be less muscle on the lower portion. Let's try. So I'm using a B2. Oops. See, it's I do have a chair, but I don't feel like sitting down, but we still need to have it for people who, who can sit and work. That is also good. So this is, I think, kind of big. So maybe I'm gonna do again the horizontal and circular here, and then I can do a B4 because that's a smaller cup. So now I'm trying to go horizontal. You guys can see going horizontal. You would know when you guys lose suction. We know. Okay. Oh. The knee joint is here, I guess. So, see, it's not. Okay, so now I'm gonna just go in circular motion. The surface area is less than what we have in the back, so not too much room to move. Okay, now I'm going to come here and I'm gonna try the B4 because it's smaller cup. So let's try. Doing okay?
Yes.
Okay. So make sure your client don't go to sleep. Keep talking and reciting duas and ruqya. So you guys can see. Is it showing, Abu? It's showing? Okay. Okay. So I think it's going to be a little bit tough to do the horizontal here. And the back portion I will do when I do the back cupping. So, okay. Now I'm going to come to the other side, which is this side. So let me get some olive oil. I'll start with the B4 and then I'll go up. Now you guys see I'm sitting on a chair that can go up and down as well. So okay, let's do the moving cupping video first and then I will cover the chair part also. So make sure we are not wearing any jewelry, no rings, no earrings. It can create tears and you know it's not a good idea to, we have to keep changing gloves and it's safer not to wear any jewelry. Now you guys can see, is it showing on the other opposite here? Okay. Now I'm able to move the massage table, but this is the most comfortable position. I'm right-handed person, so you guys can see I'm doing it like this. Now I'm going horizontal. Have to go slow because it's you know, it's not like back that I have a lot of muscle, so I don't want to lose suction. So going gradual for myofascial release and increasing the blood supply. Okay, it lost suction, so I need to apply here back, which is okay. Going all the way where I can, moving slowly. It's one suction only, but when I'm gonna start with the dry and then the hijama wet cupping, it's going to be okay. I think I lost suction again. I think now I'm in a very narrow area, so I guess maybe try to go circular if I can cover any area, but it's kind of narrow. If the client had allowed me to do here on the feet, I would have used even smaller, maybe B5, actually B6, because we don't have too much of muscle in the foot area. So, but she doesn't want to, so we'll just focus on the legs, I guess. Oops. Try one more time. We have to be very careful when we are doing the kids. It's better to do on a Thursday or Friday, you know, so the next 1 or 2 days they can, oops, see when I come down, so the kids can get time to heal and we don't want to just, you know, raise alarm. So see, it's coming off again and again. I guess we're just gonna now move to the upper. We already did the vertical here, so I guess it's okay. Okay, so I'm gonna cover this part and now I'm gonna apply a little bit of olive oil to the upper left leg. You guys can see. Now I'm gonna grab my B2 and start the moving cupping. Only one suction. Can you bear this?
Yes.
Okay. Okay, so I'm going to go vertical. Well, you can, I'm going vertical, horizontal, and then circular, but you guys can even go, if you like to go horizontal first. You can see. Okay, I think maybe I'll increase suction a little bit as it looks loose to me. Just little bit, half maybe. Going horizontal. And now going circular. Oh, I lost suction. Let me get. This can happen. Okay. Can you bear this?
Yes.
Okay, you guys can see. Oh, again. Anytime I'm not using the pump, I have to put it on the table, not on the massage, the bed. I have to put it on the equipment table. Okay, there are two different tables here. We have massage table, which is for the client, and then we have the equipment table, which is this one. That's the equipment table. That is different. So I always put the pump there, and this table is the massage table. Oh, the suction keeps losing. Okay, I'm gonna try to go slow so I don't lose suction. Okay, I think this is good enough. Okay. Now I'm going to dry my hands and put gloves on. And before that, of course, I'm going to sanitize. If you have a sink nearby, it's best to wash hands and dry. But we can, right now, this is regular trash. And I'm gonna try to dry off the legs also. I do have extra, soft tissues. So every time I'm done using this, I'm gonna cover. Cover this, and I'm going to dry this out. Okay, now I'm going to wear my hand sanitize again, and I'm going to wear my gloves. I have here 3 pairs of gloves. 1, 2, 3. And I also do have vacuum therapy machine. If I had used on the feet, I would have definitely, if they don't say, then I use the vacuum suction. Okay. So you said this region is more painful, right? So I'm gonna apply 1 and 2. Is it bearable or is it hurting?
Yeah, it's okay.
It's okay? Okay. And I'm gonna cover this part, and then I'm going to 1 second. Now I'm gonna apply the B4. Oops, saved. You can let me know So I'm going to do 1 and 2. Is it hurting?
No.
Bearable. I did actually 1.5 because I feel it's 2. Is it okay?
Okay.
Or is it tight?
No, it's okay.
Okay, you guys can see I actually did 1.5. If it was bad, I could do straight 2, but I think this looks kind of, I think this is good for her for now. Now I'm gonna try doing 2 on the top and then B4. So let's try the B2 first. Here, so I'm gonna apply one here. You guys can see I did 2 suctions here. Okay, is it bearable?
Yes.
Not painful?
No.
Okay, so I'm gonna put it back, grab my B4. You guys can see on this side, I'm gonna do 1 and 2. Okay, actually it's little less than 2 because I feel the lower leg gets, I feel more resistance. So let's wait another few minutes. You doing okay?
Yes.
Okay, so this is our next one. اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Now you guys see my chair, it is semi-adjustable. If I want to make it higher, I can do that. This is so far very comfortable for me. Sometimes I do move the table here if I want to, you know, move around, but I think so far I'm good. Usually when I'm doing the arms, I do move around on that side, but the legs, because I'm right-handed, it's the most comfortable position for my hand to rest like this and do the incisions. So, but when I'm doing the arm, I would definitely go on that maybe 2 o'clock position and sit on that angle, that area. Bismillahirrahmanirrahim. Okay. Doing okay? Not too tight anywhere?
No.
Okay. So we use 2 towels and make a tea. But I do have extra sheet here just for modesty. So now this is a basic, you know, while I'm going to be recording, I'll be doing a kahil cleanse, head and neck cleanse, and then the leg and foot cleanse. We can do variation according to patients or clients. People who are not physician, they will call their you know, the clients, and then those who are physicians, they can call patients. So it is according to the client's complaint. So I think it is 3 minutes or so. I'm just gonna look while talking. I just want to make sure that I look at the camera. What time? Okay, it is 3 minutes. Actually, it's 4 minutes, so I think we can start. So one thing I wanted to show you. You guys see, when I'm doing alcohol use before the incisions, I will make sure it's recording. Yeah, I would do clean up first, It is a little bit pink. So I would go one side circular and then turn and then do the other side like this. Although, and I'm just gonna throw this in the regular trash. And you guys can see this is my number 15 blade. You get, is it showing? Number 15? Showing? Okay. So after I clean, I do in circular motion. So this is how I hold, and the curved part is where I'm going to be doing the incisions. That's okay. So see, this is my fulcrum. I'm going to place it like this and go from right to left. Bismillahirrahmanirrahim. And it is actually very, very superficial. We are, look, just with the curved part, 2 millimeters. The 5S, you know, if you remember that chart or the picture. So I'm just using the curved part to do these gentle incisions. It's a B2 cup, so I believe I can go up to 5 lines. I usually like to go from right to left, but people do often do from top to bottom also. So, you know, and you guys will figure out what is more, you know, easy position. Now I'm going to place it in the here. We want to be it to be safe, and I'm going to put the cup back. One, and then 2. It's okay. Is it hurting? Are you okay?
Okay.
I can lose it. Tell me. It's okay? Okay. So we placed it. I'm gonna cover it, and let's check this part out. You guys can see here. Now, see my alcohol? See my alcohol? So again, so 1 wipe per cup. Now you guys can see I'm going to clean with the alcohol, round circular, and then turn it around and go another round to clean up. Throw this, and so this is my blade. I'm going to use my hand as fulcrum. I'm gonna sit down. I have to take care of my back. You guys can see, do like this, and have to go vertical from right to left. You guys can see the curved portion is where I'm just giving slight incisions, which are literally scratches, 2 millimeter. I'm gonna put it back. I'm gonna apply this. So lower one, I feel like I cannot go 2. This is okay? So I'm just doing like 1.5 because the client makes a face. Maybe I'll try another little bit, not too much, because you know her expression tells me that it's hurting her. So okay, number 3 cup. Now you guys can see. Now as I go towards this side, I'm gonna remove. Well, I feel like there was less suction because I don't see any cup marks, so I'm going to come back to it. So I'm gonna apply it back. Let me throw this because this looks like it was less, or I don't know. 1 and 2. Can you bear this, or is it hurting?
Okay. Hurting was this okay?
It's okay. Okay. So okay, I'm gonna apply it back because I feel like this cup lost suction. So let's do this one first. So you guys can see it looks like a little bit pink, purplish as compared to the rest of the area. Now this is my neck swab. I have to keep an eye on the time because I believe I have 40 minutes. Okay, clean, 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 circular motions. Other side, clean, 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 throw it. This is regular trash as this is not blood contaminated. Okay, you guys can see. Now, this is my fulcrum. I'm going to go from right to left. Bismillahirrahmanirrahim. Slowly. Are you okay? Make sure you keep talking to your client. Ami, are you okay?
Okay.
Okay. So see, I am. Some people like to hold it between the number 1 and number 3 finger. And some people like to hold between the index and the thumb. So you guys would be able to figure out what is the most convenient position. I'm going to put it back safely and reapply the cup. Can you bear this? Or is it hurting? It's okay? Okay. Okay, I'm going to cover it and now I'm going to go to that upper. I'm going to look at it first. Okay, look, it now looks really pink and purple. So possibly last time it did lose suction. Let me get the alcohol wipe. See this? Now I'm gonna throw this. See, now it's pink, or I don't know, purple pink than the rest of the skin. I'm going to throw it here. Now I'm gonna Bismillahirrahmanirrahim. Use my hand as fulcrum. Now I'm using my index finger because in this position I'm more comfortable. Now you see. Bismillahirrahmanirrahim. The hand has to always have a fulcrum. Even I'm using this finger. I do sometimes. It's just, it gives me extra stability and more balance. Okay. Now I'm going to put this back in the weight. I'm gonna reapply this back. Okay, I'm gonna do 1 and then 2. Can you bear this? Or is it tight? It's okay.
Tight.
It's tight? Now?
Okay.
Okay or tight?
Okay.
Okay. Okay, let's just cover it. Maybe give it 1 or 2 more minutes. And then we will do these. Let me just look at it. Okay, looks good. Maybe give it a minute or 2 more. This one looks good too. This one also looks good. And I think this is also good. You can see. I'm gonna cover it back. Let's wait a minute or 2. I think it is already 2 minutes, but let's give it some more time. We have to watch out for any blisters, any bruises, because that means either we are applying too much pressure with the cups or we are leaving the cups on for too long. So be mindful and be careful. Also, you know, before I started the hijama, I did ask her where all it was hurting, and she pointed more to the front, not the back, just the front of the legs. So I mean, like, you will find your own variations. You know, we can apply more cups also, but this is like a standard to do 1 2 3 4, and at the back also 1 2 3 4, and then you can do 1 and 1 here with a smaller diameter, B5 or B6. But I'm just doing right now here where she wanted me to focus. I think it's time. I will start removing with the first cup. So now when we are removing the cups, oops, sorry, we need to be careful. We need lots of napkins. Anytime the blood touches gloves, that's actually not okay. You have to change the gloves right away, because that means they are contaminated. So see, always use foot paddles, feet, like, you know, you don't want to use these gloves. So I'm gonna encircle like this, and then circle with the napkin. We don't want the blood to be spilling and, you know, going right and left. So see, like this, try to do like this. Doing okay? Okay, alhamdulillah. Keep reciting duas, ruqya, the four kuls. Now see, now this is now blood contaminated, so I'm actually gonna throw it in a separate bin, this one, like this. Now I have to tell the client I have to clean it with the alcohol wipe, so it may sting. Let me see if I have any more. I'm gonna do more cleaning. So on the blood, why am I doing this is because if the blood is still coming out, that means the body has to get rid of more toxins, toxic blood. So okay, this is the blood contaminated. I'm putting it here. Now when I'm cleaning with the alcohol, it's gonna sting, okay, mama? So for a few seconds, sorry, just for a few seconds, look, you have to go vertical. Why? Because we wanna, it is in the direction of the healing. See this? I'm gonna cover it. This is blood contaminated now. I'm gonna throw it in this trash. Let's go to the second one. Now you guys can see I'm gonna encircle the cup like this. Is it showing? Okay. So now you guys can see. I'm clean like this. Just wanna make sure that our gloves don't get contaminated with this blood. Like this. And this is blood contaminated, so I'm going to throw it in this trash. I have to tell my client on every cup it's gonna sting a little bit. Just take deep breaths. Breathing is very good. Look, I'm going top vertically. See this? Why we do that? We want to make sure there is no possible infection. So that's why we have to clean before and after. I'm going to cover it. Now I'm going to go to that one. Number three. Okay, you guys can see. I'm gonna circle it. Have to make sure again and again, reminding myself that the blood should not spill, so we need to have enough napkins, and then we need to make sure our gloves don't get contaminated. Bismillah. So you see, I cleaned it. The blood contaminated goes in this thick alcohol wipe. Now I'm gonna go in the vertical direction. Take a deep breath. It's gonna sting, and I do vertically. Okay, this is now blood contaminated, so I'm going to throw it here. Now the last cup, I'm not going to do the back because she has no symptoms, and she told me she just wants it in the front, and she thinks her feet get cold. Minneapolis get very, very cold, so she does not want to take off her socks. It's like we have minus 12 right now, so bismillah. So I'm again encircling. I'm gonna open and go like this slowly. So it's not, okay, look at this. Like this. You guys can see. Clean, clean, clean. Okay, I'm gonna come back with the napkin. This is blood contaminated, goes here. Just gonna check that there's no more blood. And here, I'm gonna clean with the alcohol wipe in a vertical direction. Bismillahirrahmanirrahim. Take a deep breath. We don't want infection, we just want to clean up. Okay. I'm gonna throw this in the blood contaminated. Now step 4 is to put coconut oil. So do you guys remember I showed you? So I'm gonna just add a little bit of coconut. It's kind of soothing, so it's good to include cold. Now you see, lots of cold coconut oil. Doing okay?
Yes.
Okay, not hurting? Now I'm going in vertical direction this is direction of the healing. I'm gonna throw this. Go to next one. Dip it in the cold, cool coconut oil. Come back here. You guys can see. Oops. Okay. Cover it back. And I'm gonna throw this. It's contaminated. I'm gonna come to number 3. And I'm gonna, okay, we did this one first. Okay, so look at that. This is good. Not hurting, doing okay?
Yes.
Okay. Now this is my number 4. I'm gonna apply here. Let me get more coconut oil, okay? Can you see? You can see here? No. Vertical. Okay. So you guys can see I've used this. This is not blood contaminated. I'm gonna throw it in regular trash. This can go in regular trash. I had extra cups in case, they're cracked or anything. So the major cleaning is basically, okay, one more thing I need to show you. I need to throw this in the sharps container, the blade. It's blade and the cups are all one-time use. So I'm gonna throw this here. The massive cleaning I'm going to do when the client leaves, but the pump cleaning I can just, I guess, do right now. And I would ask the client to change, and then so if you guys can see, I'm doing this cleaning right now. But the major cleaning I'll do later, but I will ask her to change, and we will see her in the post-treatment room. And I'm going to clean up the whole area, starting from this whole thing. I did not touch the gloves. I guess I'll just throw them because they are contaminated probably. This also goes in trash. This is unopened. The blade is unopened, so I'm going to leave that. I'm going to change my gloves. This is probably contaminated. And now I will make a next video for the after treatment care. Thank you. Stop recording.